BetaLife by BetaCare, brought to you by BetaCare Limited. I'm your host, Dr. Olawale Ogunlana, and I welcome you to today's episode. It's so good to be back in the studio once again, so I know that you guys missed all of this. But today we are going to be talking about something really interesting, and we're going to be talking about pregnancy, but something else. Now, the truth is, pregnancy can be such an overwhelming period for a woman, and this happens for a good reason. Many times it's really hard taking a decision considering the impact on the unborn child. That's in pregnancy. You can't just take a decision anyhow. Whether it is what you're going to eat, whether it is how you're going to sleep. In fact, there seems to be so many rules, and not all women are comfortable with these rules. Now, when it comes to falling sick and when it comes to illness, pregnancy can feel so overwhelming because many women don't know what to do, the drugs to take when they are feeling sick. And the rules about pregnancy medications are always constantly changing. Now, the thing is, these rules come down to weighing the benefit for the mother along with a health condition. And a complication, just even as simple as headache, can be very, very difficult to treat in pregnancy. The biggest challenge with medications in pregnancy is this. Scientists cannot perform any form of testing on pregnant women when it comes to drugs. They can't use drugs and they can't test drugs on pregnant women. So it's not really accurate to say that a medication is 100% safe in pregnancy simply because it has never been done or tested. In fact, as a matter of fact, it is ethically wrong to test any unapproved drugs on pregnant women. Now, in the past, medications have been assigned to 5-letter categories based on their level of risk. You have category A, you have category B, C, D, and category X. Now, category A is, those are the drugs that are considered safe and the safest category of drugs to take in pregnancy, whereas category X should never be used in pregnancy. So we are going to be talking about the drugs that are safe in pregnancy, and I can't do this alone. I'm going to be navigating this particular episode with a pharmacist, and with me here today I have my very good friend Loretta. Pharmacist Lawretta, you're welcome.
Thank you so much.
You're welcome. It's so good to have you. How are you doing?
I'm fine.
Welcome to Lagos. I want to properly welcome you to Lagos.
Thank you. I hope this is nice to me.
Okay, all right. We are talking about drugs now, and we are looking at it from the context of pregnancy. Now, the question that I want to ask is this, and we know that, okay, whether this is true or not. Are all drugs safe in pregnancy?
Obviously, no. Not all drugs are safe in pregnancy.
Because a lot of there are a lot of pregnant women that will come to me and ask Dr. Wale, but I can use this drug now.
Once you're pregnant, in fact, in practice, in pharmacies, even pharmacists, go anywhere, even in industries, once you're pregnant, you're considered a sick person. Sorry, we use the word sick in quotes because you are sick. Tests cannot be carried out on you, like clinical trials can't be used for clinical trials. You know, when clinical trials stages where you use healthy patients, sick patients for the placebo, those things. You can't use a pregnant woman. Yes,
basically there is always that limit because you can't do something.
You know, some of those drugs are being passed through the placenta barrier. Do you understand? So then the fetus does not have those mechanisms to absorb, distribute, or excrete. Major part is the excretion because it's the toxic metabolites that actually affects
the
babies.
Okay, so now we are saying that these toxic metabolites can actually flow through the placenta to touch the baby. Because we have to explain it for these people so I don't understand. All right. So now these toxic things get to the baby, right? Yes. So and the baby doesn't have developed systems to break it down
and also excrete it from them.
Okay, you see, and that's where the issues are.
And the funny thing is that some of them don't know. They assume just like some drugs. Obviously, when you're not sick or when you're not pregnant. Sorry, I'm using the word. When you're not pregnant, you find out that you can take any drug at all. I have my aunt yesterday. She asked me. She called me and said, "Can I take this drug?" She's not asking me for her baby. So when she asked me, I was like, "Is it for your baby?" She not said, "No, it's the one inside my stomach." So she's not being very careful on the drugs to take. Not just for her baby now, but because she already knows that she has had multiple miscarriage, subcontent. So she's trying to be careful of whatever she takes. Because some of these drugs, you see women frequent multiple miscarriages.
Yes.
Do you understand?
Mm-hmm.
Some don't even know that it's the drugs they are taking, but they assume that if I can take it this period, I can take it this period.
It's not every drug that is safe in each trimester, like in the first, second, third trimesters of pregnancy. Like for example, when you talk about a drug like Fancy, that a lot of women do not understand that before 16 weeks, you are not even supposed to take it at all.
Because they already heard that it's safe in pregnancy. So once they give
when they just hear that green light,
go ahead.
Exactly. And even when you talk about drugs like even artemether.
Exactly. That was one next to mention. You understand? Artemether, common loners, Coartem, all those drugs. It is not safe in first trimester at all. Some people can tell it's safe, they are lucky, but there is still, it's not confirmed yet that it's safe. Yes, so don't take it at all.
The best thing is I think what we just need to agree on is whenever you need to take drug as a pregnant woman, you need to ask questions. Yes. You need to see your doctor, you need to consult with a pharmacist if possible. To be sure if it works. So anyway, we will go on a break right now and we will be right back. Just stay with us because we still have a lot of things to discuss.
Hey! If you're thinking about seeing or having seamless access to a medical doctor, having a better healthcare service, or even meeting a health specialist, then you are probably wondering, do I need to go through the stress of traffic and spending so much time just to see a doctor? How about the long queues and overcrowded corridors at the hospital? How much money do I have to spend? Well, you don't need to worry, we have got you. With Better Care, you can talk to a highly competent and unbiased medical doctor through video, audio or chat. Better Care gives you access to professional prescription, drug delivery, lab orders and bookings, unlimited access to specialists, seamless payment methods, secure payment records and so much more. Our goal is to improve patient engagement, satisfaction and general well-being by providing secure and safe platform, 24/7 advanced care, affordable pricing and holistic care. Sign up today. Talking to a medical doctor has never been this easy. Everybody deserves better care.
You're welcome to the BetaLife show, brought to you by Better Care Limited, a platform that revolutionizes doctor and patient relationship. And today we're actually talking about the drugs to avoid in pregnancy. And I'm here with Pharmacist Lawretta. We've been having this conversation and it's been interesting actually. So now the next question that we want to talk about now is, what are the drugs to avoid and why?
Range of drugs.
Yes, we'll just list a few for them, so that especially the ones that people commonly abuse.
Yes. Okay, we've talked about the anti-malaria. Then for malaria in pregnancy, hypertension in pregnancy, I think that's another common condition.
Yes.
And I have to put it out there that once they're pregnant, I've seen people that, first pregnancy, I don't have BP. Second pregnancy, I don't have BP. So third pregnancy, where's BP coming from? I know the funny thing, they don't register for antenatal on time because I've mastered my body. But
everybody, when you tell them that they should come
they believe that they just believe that, oh, I know everything, I know what to do, I know what to take. It's not just take folic acid.
Yes.
But for that, there are vital signs so you see them presenting in the hospital with BPs way above normal values. So some of the drugs that are actually better safe, you have the labetalol, they are safe. Nifedipine, they are safe. Methyldopa, they are safe.
Yes.
But you see the common ones like amlodipine, please stay away. Lisinopril, stay away. Those ones, they are not safe in pregnancy. Even which other one that is safe again? The other ones that are better safe, like just few classes, obviously. Do you understand? That's why you see them place them on methyldopa, 250, 500,
most of them, especially like methyldopa. For those that don't know, that is actually Aldomet. So it's actually known as Aldomet. So it's considered safe in pregnancy. Nifedipine is also and labetalol, it's also
so
considered
they are all
safe
in pregnancy.
All
do you understand? So, but of course, you know, lisinopril and amlodipine is much common.
Yes, those are common drugs that people use, and somebody might have it at home and say,
do you understand? I go to hospital.
And then they say that the drug I want to buy is expensive. Whoa. I have this particular drug.
Do you know how the issue is come? Sometimes they come to the pharmacy, they will not tell you they are pregnant. So they will check their BP and it's high. Oh, don't worry, my husband has amlodipine at home. Or my husband has lisinopril at home. Oh, that's what my husband have. By this company. What it is? It's your clear conscience. I have a colleague that it has happened to. And he said, okay, go ahead, take. Do you understand? Without being pre-informed that I'm pregnant.
This person is actually pregnant.
Do you understand?
Yes.
So it's always better and good to tell them that, please tell your care provider your condition at that moment before prescribing any drug. Another one is chlorphenicol. This one causes great baby syndrome. A lot of people don't know, they use it for many things. Many things. Like especially maybe if they are having infection. You know, people just take drugs. You know that chlorphenicol is an antibiotic, but it is now an OTC for like you take it for many things. And then when you're asking them questions, even normal patients, even people that are not pregnant, chlorphenicol is like a drug that is being phased out.
Yes.
And because of the side effects it comes with, do you understand? So imagine a pregnant woman taking it. So it will cause great baby syndrome to be fetus.
And the baby will be grey, be born grey.
You see the grey colored. So then another drug is your statins. Statins, you know, for patients that have hyperlipidemia, that is high cholesterol, high blood cholesterol. So normally rosuvastatin, atorvastatin are being placed because those ones have to block the production of cholesterol. But in pregnancy, no cholesterol is needed for formation of the baby. Yes. In this case now, so you don't use statins. So instead, you use bile acid spectrans. Those ones that are easier, are more tolerable for the pregnant women. Do you understand? So. I think metformin is also safe in pregnancy. Yes,
that's for diabetics.
For diabetic patients now. Then you have tetracycline.
Yes, that's one. You know, we have to just really calm down and talk about tetracycline.
Tetracycline.
Especially for those that have been born or people who have children that have a discoloration of their teeth. You know, people do not know that tetracycline is the one that is responsible for that.
Tetracycline is now turning into the new vitamin C actually.
You know, somebody was telling me that, doctor, I was purging, I was having diarrhea now for the past 3 days, so I just had to quickly take tetracycline. And he was saying this so casually, you know, it was the audacity, the way he was just saying it so casually, like, I went and I took
tetracycline.
Like tetracycline. Wow, like just wow.
Like, you know, funny too, when they say it's like, it's not tetracycline, I have it now. That kind of, it's not part of his 8 boxes now. You know, that's why I took this antibiotic resistance fight on myself because, God, why?
We abuse drugs. That's why drugs don't work anymore. They are no longer effective.
Resistance is building up. And you know, funny, let me put this out here. There is now tendency of mother to child antibiotic resistance. You see a child in the hospital and some of the drugs, the baby is already resistant to it. It's from the mother, the drugs mother already take. You're seeing a baby and then they're placing a baby on meropenem. A baby. So if I'm using meropenem for a case like this, that is resistant to other drugs, what am I going to use when you come down with infection later in life? Do you understand? So these things, even for the mother, okay, for the mother, the tetracycline, then you take it, the baby is born with brownish teeth. It's because this is like they're buying to calcium. I know the calcium is there for babies formation,
yes, I know for bones, enamel, and the teeth.
So it forms an unabsorbable complex, and then they put it in the bones and in the teeth. That's why you see those brownish coloration on the teeth.
So if your parents, if you have that kind of teeth, you know who to blame. I know, but that's just the truth. But anyway, we'll go on a break. We'll be right back.
My name is Dr. Alfred, and I'm a pediatrician. Nowadays, I get to attend to so many children, and it gives me so much joy and fulfillment, knowing that I get to take care of my patients.
Adding to the fact that at least 60% of individuals who seek urgent medical attention can get the same quality service at the comfort of their space without hassle or the fear of spending the whole day at the hospital.
Doctors are easily accessible while patients get better care. Sign up to our website at www.bettercare.ng.
Better care.
Revolutionizing doctor-patient relationship.
Hey. If you're thinking about seeing or having seamless access to a medical doctor, having a better healthcare service, or even meeting a health specialist, then you are probably wondering, do I need to go through the stress of traffic and spending so much time just to see a doctor? How about the long queues and overcrowded corridors at the hospital? How much money do I have to spend? Well, you don't need to worry, we have got you. With Better Care, you can talk to a highly competent and unbiased medical doctor through video, audio, or chat. Better Care gives you access to professional prescription, drug delivery, lab orders and bookings, unlimited access to specialists, seamless payment methods, secure payment records, and so much more. Our goal is to improve patient engagement, satisfaction, and general well-being by providing secure and safe platform, 24/7 advanced care, affordable pricing, and holistic care. Sign up today. Talking to a medical doctor has never been this easy. Everybody deserves better care.
Welcome back. You're still watching the BetaLife show brought to you by BetaCare Limited, a platform that revolutionizes doctor and patient relationship. We are still on the conversation, drugs to avoid in pregnancy. We've talked a lot. We've had so many conversations. I'm here with Pharmacist Lawretta, and a lot of things have been unveiled. But we just have a few more drugs that we still want to talk about, because many of them still they think we are finished shaking the table, but once finish, let's break it once and for all. We break this table, and that will be all. So the next drug, what is it?
Ciprofloxacin.
Ha! You see that ciprofloxacin there? You see that ciprofloxacin? Oh,
typhoid and malaria.
Doctor, I have typhoid, so I use Cipro. Basically, the class of that drug is a fluoroquinolone. That's actually the class of drug. So it has ciproflox, levofloxacin, ofloxacin. So they are actually in the same class. So, and many people do not understand that a lot of research, a lot of clinical research has gone into the fact that ciproflox on its own can actually be responsible for miscarriages, especially in the first trimester. Abi?
Yes.
Abi? They don't know.
Bone malformations, bone weakness, low birth weight.
And even for old people, many people don't understand.
Yeah. Even young people, overdosing of these drugs can cause bone deformation. If young children, you don't even try it at all. Like, you only use it in cases whereby the benefit
outweighs the risk.
And when I mean the benefit outweighs the risk, you must have done tests
and see that this is the only drug that can take us out of this land of Egypt.
That is all.
And the truth is that many of them actually don't get it, that some of these drugs are only prescribed when it is the only way out.
I come to Nigeria where I'm sick today. I took this drug. Oh, you are sick, you're having the same symptoms, so come and take
the same drug. The last time my doctor actually wrote these drugs for me.
Fam, give me Ciprotab. I have headache. I know it's typhoid. Ma, please, how do you know it's typhoid? And you see how it speaks to man. Ma, please, I need Ciprotab. But ma, Ciprotab is not safe for you. Have you spoken to your doctor? Don't worry, I know. They're just avoiding the whole queue in the hospital.
Yes.
Well, it's for your own benefit.
And it's actually for your own good, and it's actually for your own benefit. So ciproflox should be avoided. In fact, the fluoroquinolone class of drugs should be totally avoided in pregnancy, except the benefits of using that drug outweighs the risk. So
then,
let's go to the next one.
Another drug is your NSAIDs. Ibuprofen, diclofenac, piroxicam, name them, celecoxib, all of them.
All of them. Doctor, my body is paining me. My body is paining me. My body, I have headache. I use this one. I'm having joint pain. I use it. Seriously.
There's cases, fetal doctors arteriosis. You can explain the condition.
Now, actually, I think I need to explain it. So
in simpler terms.
In simpler terms, so that they will understand. Yes. All right. So basically, usually, when the heart is growing, there's actually something that they call the ductus arteriosus. So it's a hole, and that hole is expected to close. So you see, when you use drugs like diclofenac, you use drugs like ibuprofen, this hole refuses to close, or it delays in closing. And when the baby is born with such kind of defect, it can actually lead to certain forms of heart disease, open heart disease, and all of that. So it can cause a lot of issues for the child. So that's why when we say that do not use diclofenac, do not use ibuprofen, because many don't use cataflam. All those drugs. In pregnancy, whenever you are having anything like headache, paracetamol, yes, but even at that, you still have to go and see your doctor.
As simple as headache. It's very simple as headache. I feel we need to put it out there that before, as a pregnant woman, before you take anything at all, please see your doctor.
Just see your doctor.
Or even if you're going to the pharmacist, just tell them that, yes, I am pregnant.
I am pregnant because not every one of them, their pregnancy will even show.
And you know what? That first trimester is like the most delicate part of the pregnancy. So obviously, at first trimester, something is not showing. How do you expect the person to know if you don't tell the person?
If you don't tell. Okay, so now, do we have a final one that we want to let people know?
That's all. Aminoglycosides.
Aminoglycosides, like gentamicin, they are not generally accessible because they usually come in injection format.
And then even when you want to use it, it's always on prescription. Most of the time, it's like second line treatments for some conditions.
So anyway, I think we all get the idea that pregnancy is a very sensitive time for both the woman and the unborn child. And it is up to every one of us, both your healthcare professional and the individual, to be able to know that each time in pregnancy you need treatment. There are certain things that you need to do. The first thing being seeing your doctor. That's the first thing. If you're going to use a drug for a certain condition, make sure that it has been approved by your doctor for use.
Okay, I have one last thing to say.
Yes, of course.
Same way that you avoid those drugs while pregnant, while breastfeeding, please avoid them too, because obviously some of these drugs are being excreted from the breast milk, and just like the tetracycline. You will still experience those side effects. The baby's system is not fully matured enough to break down, excrete them, so they can also affect the child.
Yes.
And if you even want to take any drug, I remember when my aunt was pregnant. Okay, amoxicillin. Penicillins are one of the safest drugs you can take in pregnancy. Very safe.
Yes.
Do you understand? So those drugs you avoid when you're pregnant, please avoid them while you're breastfeeding. Don't say, oh, I'm no longer pregnant, I cannot take
so I
this
can now,
drug.
yes, because many of them can actually be also excreted in breast milk, and they will still have the same effect, or if not even worse. So we have come to the end of today's live show. It's a pleasure to have you.
Thank you.
Thank you so much for helping us to break the table. I'm sure that many of I'm sure that many of our viewers out there now will be like, so this is what I've been doing. So it is good though. It is good that you know. Now that you know, there is no more room for ignorance. So thank you so much.
Thank you.
And on behalf of Pharmacist Lawretta and myself, I want to say thank you also for watching to the end of the show. Now you know very well that this program is brought to you by BetaCare Limited, and the platform actually betacare.ng actually revolutionizes doctor and patient relationships. You can actually see a doctor even from your home. So you can consult with a doctor, you can book appointments, you can see a doctor if need be. So make sure you go to their platforms and register and meet with a doctor if you need to meet with a doctor. We'll continue this conversation online. All the handles and everything are actually displaying on your screen right now. So until next time, make sure that you stay safe and follow everything that I'm telling you. Yeah, follow everything that I'm telling you. All right, so take care. Bye-bye.
Thank you.